So New South Wales recorded 145 locally acquired cases of COVID in the 24 hours to 8 p.m. last night. And yesterday we reported 2 deaths, which have been included in today's numbers. Sadly, we're still seeing a large number of cases infectious in the community, 58 cases, and 25 were for part of their infectious period. And this highlights that even as you're moving about, assume that you could be in contact with someone who has COVID. So please make sure you're wearing your mask appropriately and you're staying your distance, at least 1.5 metres away from everyone. It is also important that we maintain that testing, and it's so pleasing to see 98,158 tests. So I think we've seen almost that 100,000 mark met over a number of days. I'd like to give 2 key messages. We are seeing that the transmissions at the moment are being driven by 2 factors. One is ongoing contact between households. And can I just express my deep understanding of how it is so important, people's extended families and friends. But at this time, when we're responding to such a crisis, it's really important that people only stay within their household unit and don't have any mixing between households. We've also, the other key message would be about vaccination. If we are to, as the Premier had said, the future is driven by our vaccination coverage. And clearly the vaccines have twofold protection. Firstly, they provide, if you're vaccinated, they protect you, but they also have an impact on protecting others. So if you're infected and you're vaccinated, you're less likely to pass it on to others. So at this point in time, while vaccinations are not the whole answer at the moment, and we need to maintain the lockdown as tight as possible, vaccination is part of the answer. And so I would urge everyone in the community to please come forward and get vaccinated. There are a number of pharmacies in southwestern Sydney that will be able to administer AstraZeneca today. And these pharmacies will be listed on our website, highlighting where to get the vaccines. And just to message, there's some at Bankstown, Bass Hill, Cabramatta, Carnes Hill, Casula, Liverpool, Greenacre, Fairfield, Panania, and a vast array of suburbs. And we see that pharmacy access to the vaccine will support the local community. So please, AstraZeneca will be available through these pharmacies, and I urge everyone today to go onto the website and find their local pharmacy that's got access to the vaccine and go forward and talk to their pharmacist about getting vaccinated. In terms of the areas that we want to call out, we're calling out a number of areas for increased testing. So on the North Coast, we're still interested in having high rates of testing around Coffs Harbour, Byron and Ballina. In Southern Highlands, Mossvale, we've had a couple of low sewage detections in Mossvale, and we don't have an obvious source there, so we're very watchful. We are doing daily sewage to investigate that. Again, keep that testing up in Orange, but it's been pleasing so far that we've seen no ongoing transmission. And in Western Sydney, Cumberland, local government areas, in particular Marylands and Guildford, Toowoomba, Pendle Hill, Mount Druitt, Rooty Hill and Blacktown and Western Sydney in general. There's also the Inner West and some areas in southwestern Sydney. Per our messaging, we need to continue to see those high rates of testing. Just wanted to also mention that we are responding to an infectious healthcare worker who was at Liverpool Hospital, and that person worked whilst infectious. The district is working promptly to support urgent patient testing, and updates will be provided later in the day. Thank you.